Whether or not a facelift is for you is really not age dependent. It depends completely on facial anatomy, aging changes, and lastly on your medical suitability. Better candidates are patients with strong bone foundation, they have a higher neckline, have thinner skin for the redraping, and lastly, they're not at risk for wound healing issues. Smokers, patients with poor medical condition obviously are not going to do as well. Those kind of patients will still benefit, but they need to make sure their expectations are appropriately set. And those with a weaker jawline, those with more of a low set neck bone, thicker or ruddy skin, just might not get that perfect result that they're looking for. Lastly, patients that are smokers, they have poorly controlled diabetes, they have blood pressure issues, they have connective tissue disorders or something rare of that nature, like a bleeding disorder, they might be at a slightly higher risk of a surgical issue. It doesn't mean that surgery is not for them, it just means that all of those issues need to be tuned up as much as possible prior to surgery. Most importantly, surgical candidates must have the appropriate expectations. They need to understand the limitations of surgery and the fact that wound healing is really dependent on each person specifically. Lastly, having no concerning psychological or psychiatric issues is definitely important.